Guys, after subscribing to this channel, please make sure that you also press the bell icon so that no notification, no new video of mine, any educational video, is missed by anybody.
Now, as far as delivery is concerned, the C-section, routine C-section is not recommended. Patient can undergo a vaginal delivery as well, but there are certain things that you have to keep in mind. Of course, the universal precaution scheme has to be managed because the patient is definitely infected with hepatitis virus and has a very high risk of transmission to the care providers. So that's definitely universal precautions. You've answered so many questions on that, and you got to be understanding that how much the plastic sheet, plastic apron, disposable gloves, two gloves, disposable gowns have to be managed, because you do not have to put it again through sterilization process and then reuse it again. So reusable items should not be used for the delivery of the patient. Now, as far as the newborn is concerned, so the newborn, and suppose if any person still accidentally gets pricked or gets exposed to the hepatitis B virus, then what will you do? You have to go, of course, you have to take the hepatitis B vaccination again, and you have to go for hepatitis B immunoglobulin immediately, not 14 days later from the day of exposure, because after that the damage is almost done. The virus starts replicating and forms and starts causing inflammation and injury, and what do I say, the infection is already established in your body. So if you want to combat the infection, you have to take immunoglobulin pretty early in the course of the disease. And as far as the newborn is concerned, yes, the newborn has to be given the entire course of the hepatitis B vaccine that is 016 schedule for us, and for the neonate as well. The dose is slightly different for the neonate and for the adults, but it's a very important vaccine to be taken, not to be missed. All healthcare providers have taken it and should take it, and the newborn should also be given immunoglobulin as well, because it has a very high chance of vertical transmission, hepatitis B virus. So that was all about the prevention as well, about the newborn as well. All these topics have been included. The serology is pretty crystal clear now to you, and I'll be posting a few questions on this pretty soon, and I hope to get a good answer from at least my students who have seen this class properly. So next up will be hepatitis C virus. Stay tuned. Now we come to hepatitis C virus. Unlike hepatitis B virus, the immunology of hepatitis C virus is actually not available and not very discrete. That's the problem. So there is actually no test to finally understand the current ongoing hepatitis C infection unless, of course, hepatitis C virus RNA particles can be found out. Now let me take you through the course of this disease. As far as etiology is concerned, it's right there in front of you. It is hepatitis C virus which causes this disease. It is spread through mostly through IV drug abuse in developed countries. In countries like India, again, the secretions, they are responsible for for transmitting. That means it's basically a blood-borne infection or a serum-borne infection. Once the patient is infected with this hepatitis C virus, for months together, the patient can stay asymptomatic. So the first to develop is anti-HCV antibodies. That means I'm talking not about this is the core antigen antibody. No, not that. Anti-HCV. When we write this test down, we write like this: anti-HCV antibodies. That means everything over here is in capital, and we write HCV, not unlike antigen over there. So anti-HCV antibodies, they develop and they remain almost throughout the life. So, and the titer also doesn't change. Even IgM for that matter. Now, acute and chronic infection, the titer doesn't change much. So if you want to really find out whether the patient has been infected right now or is a chronic carrier, is a chronic infected patient, there is no way to actually find out until and unless you know that this patient was earlier IgM negative and now it is IgM positive. That means he is currently having the infection. Otherwise, it's very difficult to find out whether acute infection is going on or is this patient a chronic carrier. We do not know anything about it. So serology is not very discrete in case of the HCV infection. So how do you diagnose it? You diagnose it, of course, through these antibodies, because now they are universal screening program. They should be incorporated. They have been incorporated. We've been writing down for all our patients. Like we write HIV, we write anti-HBS, we write HBS antigen. Now we write down anti-HCV antibodies also to find out whether the patient is infected with this virus or not, because chronic carrier state of HCV virus is highly linked with cirrhosis, liver failure, acute and chronic infections, and a lot of morbidity, mortality. Plus, it's very difficult to understand this infection. Not much is known, and nothing is very discreet. So, follow up is also very, very important of this patient. So, once these antibodies come out to be positive, what is your second step? You find out the HCV RNA load, and from there, you'll have to make up a team with gastroenterologist or hepatologist, and you'll have to continue with the management as a team, because they obviously know better than you, unlike in case of hepatitis B virus, where we knew a lot about the virus and we kind of know how to manage as well. But this, what course will it take during the pregnancy, because it's an immunocompromised state? Yes, the vertical transmission is known from the parent to the newborn, but breastfeeding, coughing, sneezing, touching, these things should not be avoided, because in case of newborns, when a newborn is born to a patient who is already infected with HCV virus, there are relatives who abandon all these things, so these things have to be counseled at the time of delivery. As far as delivery is concerned, the patient should not be forced to have a C-section, though the transmission rate is somewhat lower with C-section as compared to the vaginal delivery, but yes, the patient should be counseled accordingly. So as far as management is concerned, the management has to be supportive like in all other viral diseases. So again, HCV, like I said, unlike HBV, is little less known and less to understand over there, because not much things about it are black and white. It's one thing which you should know about it is that despite the fact that it's an infection, you do not get to know whether it's an acute disease or a chronic disease, which is the most important and a handicapping factor, because if it's an acute infection, there is a different set of management. If it's a chronic infection, you tend to take it as one of those diseases like hypertension or diabetes, which are ongoing, just supportive management. But if it's an acute infection, it can derail any time, so you should know that as well. Anyways, when it comes to hepatitis D virus, we should know that hepatitis D virus is an incomplete virus. It usually is associated only with hepatitis B virus co-infection. It is called also piggy tail infection, because it needs hepatitis B virus to co-infect in the body. It does not work on its own. It's an incomplete virus. So any patient who is suffering with HBV hepatitis B virus, you should also get done a profile of, and over here, hepatitis D virus, you go in for a PCR. There is no antibody test for hepatitis D virus, you should know that. So if any patient is HBs antigen positive, if you want to see a co-infection, whether it is there or not with hepatitis D virus, you should go for a HDV PCR, HDV RNA PCR. And the last segment now, we'll be discussing about hepatitis E virus. And now regarding hepatitis E virus, now as far as hepatitis E virus is concerned, there are certain serotypes available, serotype 1, 2, which are associated with poor sanitation and what is basically, waterborne diseases. It goes through fecal-oral route. And as far as serotypes 3 and 4 are concerned, they are propagated through undercooked food, raw meat, and certain food items, undercooked meat and shellfish, which are responsible for the development and spread of hepatitis E virus. Hepatitis E virus wouldn't have been discussed over here had it not been for its close proximity to pregnancy and deleterious effects in pregnancy, because in case of pregnancy, it is an immunocompromised state. I told you about the etiology. Now I'll tell you about the signs and symptoms. Signs and symptoms, they take around 15 to 30 days or even 40 days to develop. They include the same thing, acute, onset of fever, sometimes rigor, chills, nausea, vomiting, abdominal discomfort, abdominal distension, maybe loose motions, loose stools, vomiting, of course. So these are basically the signs and symptoms of hepatitis E virus, like all other viral diseases, the same thing over here. But the diagnosis is made through hepatitis E virus antibodies, IgG and IgM. So you can also make it through RNA PCR, but the serologic tests for this virus are also available. So if a patient is having these kind of symptoms and all other serologies are coming negative and the serum transaminase levels are high, this should be a diagnosis of a choice to you, that you should kind of send the test for anti-HEV antibodies, both IgG and IgM, for you to understand, for you to make a diagnosis of hepatitis E virus as early as possible, because otherwise the mortality is pretty pretty low, maybe around 1% or so. But in pregnancy, the mortality can go to as high as 30% with hepatitis E virus, because of the innate, adaptation of the virus in pregnancy, which allows its easy replication, and hence the cytotrophic effect, damaging the hepatocytes and causing fulminant hepatitis and its sequelae. So hepatitis E virus is definitely dangerous in pregnancy. The basic mechanism of management remains the same. You have to go for supportive treatment, which is the most dangerous part, because once a patient has gone in that cycle, I've myself not seen patients come out of it. This is one of the most dreaded infections in pregnancy, has to be taken seriously, has its own fulminant nature of and its course, and unfortunately, not much we have to help the patient, except for supportive treatment. So with this, I finish with all the hepatitis in pregnancy, and the most important and the fundamental being hepatitis B. So I hope that this lecture gave you some value regarding hepatitis, and you will come out wiser after seeing this discussion. So thank you so much.